This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on 9TV.
The signs and symptoms are easy to spot. Those suffering from Tourette syndrome may demonstrate often uncontrollable and repetitive movements and sound called tics.
Tourette syndrome is a neurologic disorder characterized by multiple motor and vocal tics. This usually occurs in children below 18 years old, and it should occur in usually within a year. It can wax and wane within that year, but there's no remission within 3 months.
This neurological disorder was previously poorly understood and considered rare and odd.
You may notice simple tics at first, and then minsan they get worse as they approach early adolescence, and they may wane when they go into early adulthood or late adolescence.
While there is no cure, those with Tourette syndrome usually live a normal lifespan, with many available coping methods such as psychotherapy, deep brain stimulation, behavior therapy, selected medications, and other relaxation techniques. What disorders are associated with Tourette syndrome? Should your child take medication for this neurological disorder? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Aida Salonga. She's the head of Child Neurosciences at the Manila Doctors Hospital. Also with us is Dr. Anthony Piano, a neurologist and a movement disorder specialist at the Medical City. You may join the discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to MedTalk.
Good evening, Angel.
Tourette syndrome. We hardly hear of Tourette syndrome. So, doctors, what should we understand about it? Let's start with Dr. Aida.
Well, actually, most probably the reason why we hardly hear about it is because it is underdiagnosed or underrecognized. But if you look around, madami yan eh, no? Okay, a good example, yung mga mali-mali ng mga tao, di ba?
Okay.
Yung mga biglang, gano'n, di ba?
Oo.
Probably, some of them are cases of Tourette, no? And because yung Tourette kasi is a spectrum, yung clinical symptoms, is spectrum yon that starts from a very benign kuminsan mga, we call them tics or motor tics. And then, which usually disappear naman sila by adolescent. But there are some who progress into what we call as Tourette, na meron ng kasamang mga tinatawag na vocal tics.
Okay.
So basically, the definition kasi of a tic is actually, it's an involuntary, or some will even say it's semi-voluntary. Because you have you're knowledgeable that you're gonna move, no, but there's this an urge, or there's an uncomfortable feeling that makes you move. All right? So, kaya malamang sinasabi nilang mali-mali because these are actually very visible, particularly motor tics, no? These are very visible actions that are actually perceived by the people around them as something na may pagkakamali or there's something wrong. But for the patient or for the person who has the tics, parang sa kanya it's normal, no? So it's nothing for him. It's not bothersome for these patients or this person.
If you look at the worldwide statistics, parang 1% yung prevalence.
Okay.
But it ranges from in some other countries. Meron akong nakita even in South Africa, parang 3 to 5%. So kung titingnan mo, ang kanyang prevalence is almost the same as epilepsy.
Okay.
So, ibig lang sabihin, baka nga hindi masyado lang nating re-recognize. Before, kasi ganun din yung epilepsy. People thought na, ay, wala naman, kukonti naman yan. Oo, but when they started looking at figures, nakita nila na mas mataas kesa dun sa dati.
Doc Tonyo.
Okay. Yes. So for parents, usually what I've observed naman in the clinics, so it's usually the parents who are overly recognizing. No? So they keep on labeling certain movements that could be tics, that could not be tics. So tics in general are, first off, they should be repetitive. These are repetitive movements. All right. They might not be purposeful. Some of them might be purposeful. And then there's always that key defining factor that there should be an urge, an uncomfortable feeling that makes the patient or the child move. No? So if you feel that your child might have that tic, I think it's always best and safe to bring your patient to a doctor. Because it's quite difficult to differentiate a tic, for example, with a child who might be having an attention-seeking behavior.
Yes.
All right. There are certain movement disorders that could be psychogenic. No? There are certain tics that could actually be seizures or epilepsy. So there are many aspects that can mimic a tic. So the safest thing for a mother or a father, or for parents in general, if they suspect that they have this behavioral abnormalities, particularly movements or vocalization, then you have to see a specialist or even just a doctor, I think, to at least get them checked.
Okay. Is there a certain age when these behavioral patterns come out, Doc Aida?
From data, from observational studies, common na nagsisimula ang tics during the younger age, mga 4 or 5 years.
Okay.
And then, pero merong siyang bimodal, ang sabi nila. Merong sa younger age at merong sa adolescent and adulthood.
Okay.
Now, ang observation ng mga studies na nabasa ko, when they start during early age, karamihan doon, more than 50% nawawala by adolescent.
Yes.
Okay.
And then, when they start naman ng adolescent, yun ang kumisa nag-persevere hanggang adulthood sila. Pero siguro ang kailangan niyang ma-emphasize. Ako kasi, my advantage is I practice both child and adult. So parang when patients come to me, kailangan, hindi mo kasi madadiagnose kaagad na Tourette sa unang punta. You have to partner with the parents and with the family para mas ma-observe. Because this is a clinical, we call it a clinical diagnosis. Hindi kahit MRI mo or ano.
Or i-blood test.
Or i-blood test. Pero ang pinaka-importante, like what Dr. Tonyo was saying, the behavior are actually, di ba parang, they are involuntary. Pero what is most important is to distinguish or to find out if it is caused by any other disease. Because tic per se or Tourette per se are primary disorders. Pero kung minsan, simptomas sila ng ibang diseases. Kaya importante yung ma-examine ng doktor, no? Oo, para malaman. And ang isang pinaka-importante na malaman is, eto bang mga motor tics na ganito, hindi ba ito sign ng epilepsy? Kasi tinatawag na focal epilepsy, kumisan, focal motor din siya, na parang tic din.
Okay.
Oo.
We've been talking about tics. I'm sure our audience would like to understand it a lot better, since there's no MRI, no blood test to diagnose someone who might have Tourette syndrome. What exactly are the characteristics of the tics? How do they manifest? And are there levels by which you determine if this individual indeed has Tourette syndrome? Dr. Tonyo.
So tics are clinical, are diagnosed clinically. So tics are generally divided into two categories. No? You have your motor tics and then your vocal tics. So motor tics are action tics. These are movement. And then your vocal tics are, vocal tics are starting to be removed. No? They're trying to change the name to phonetic tics, meaning these are sounds, not necessarily vocalization. It could be sounds. So these two broad categories can further be subdivided into two more smaller groups. These are your simple tics and then your complex tics. So you have your simple and complex motor tics, and then you also have your simple and complex vocal tics. So I think the best way to describe them is actually to give examples
Yes,
of what
please.
they are.
Yes,
So you
or even to make a sound or a movement.
Yes, all right. So for
Doc,
simple
please.
tics, you might notice now for the more common ones are eye blinking. So you'd notice, I'll remove my glasses.
Yes,
so you
please.
notice people doing this. So sometimes they keep on doing this. So these are motor tics. Some patients would tend to just keep on looking to the side. All right. Some would just have shrugging of their shoulders. So these are simple motor tics. They're simple movements.
Okay, doctor, you started with the eyes.
Yes.
Sometimes when we're tired or when we're stressed,
Yes.
there is that movement that we make, or involuntary movement for that matter. Can that be a mild form?
So some
Tourette?
people, well, I think majority of us will experience this. No, sometimes you have this twitching at the lower lid, right?
Yes.
You'll have some twitching. These are not tics. No, these are usually some would call them fasciculations. Some of them will call them myokemia. By definition, these are muscle movements that are usually due to fatigue. All right, so they are not necessarily tics because you are not intending to move them, and you don't have the urge for that to manifest.
Okay.
So that's for your simple motor tics. Your complex motor tics, by definition, it's complex. So it's more of a series of activities. So someone might have neck stretching and then they'll have movements of their arms. Some would actually start touching indecent parts, either of themselves or of others.
Okay.
So that's quite alarming. So some
Yes.
of they don't intend to do it, but there's that urge to relieve it. All right. Some might be hopping around. So those are usually your common complex motor tics. For vocal tics, simple vocal tics would include grunting and clearing of the throat. So some will go, so snorting could be a simple phonetic tics. No, more complex vocal tics would include utterance of words and phrases. So you keep on repeating phrases, for example, ano ba, ano ba, ano ba. You're in a conversation and then you have to inject ano ba, ano ba, ano ba. So it's not, doesn't mean anything, but especially in a conversation, but it's injected because you have that urge to say it.
So these complex and simple motor and phonetic tics should be diagnosed by a doctor.
I think so.
You should be seen by a doctor because sometimes when you're conversing with friends or even workmates, and the little examples that you gave, sometimes they come out.
Yes.
Unintentionally, sometimes by intention, but we shouldn't conclude or judge,
Yes,
if I may
exactly.
say so, that there might be a disorder from one of the individuals who manifest this type of behavior. We'll understand more about Tourette syndrome. We'll get to know more about this disorder. All that and more when MedTalk returns.
Did you know that Tourette syndrome is named after French neurologist Georges Gillet de la Tourette? He published an account of several patients who showed symptoms of the disorder in 1885, one of which involved an 86-year-old French noblewoman.
We're back here on MedTalk, still talking about Tourette syndrome. Doctors, we were talking about tics. You gave some examples. How about stopping those tics? If the individual is aware, can you temporarily stop it? You have that urge. And maybe when you have that urge, can you tell yourself, can you remind yourself, okay, I shouldn't release these bad words, or I shouldn't, touch someone's body parts. Yes. Is that possible?
Well, actually, yes. No? So that's another characteristic of tics. No? They are temporarily suppressible. They can suppress it for a short period of time. When you do that, it's actually part of how we see patients in the clinics. You actually ask the patient to try to suppress the tics, right? And then when you suppress them, you can see that there's the urge starts to grow, and then the discomfort starts to build up. And then when you tell them that they can start to manifest their tics, then you'll have what we call a rebound phenomenon. When the rebound phenomenon, so the tics becomes very florid. All sorts of tics will come out because they have to release it. And then after that, it will go back and balance out and then just become your normal, regular tics. No? So temporarily, they are suppressible.
Okay, these tics come from, where do they come from? Nerves? Which
From
part
the
of the
brain.
brain? Yeah, which part of the brain, and what nerves are affected when one has a tic?
Wala pang definite na define in terms of a specific anatomical location, pero it revolves around the neurotransmitter release, no?
Yes.
Kaya yung mga dopamine related dun sa ibang mga movement disorders. Kaya yung sometimes if they have to give medications,
Yes.
yung ginagamit na medications are related to to either suppressing dopamine release or improving, no, yung parang balance ng dopamine and norepinephrine, no, in the body, no. Oo. Pero maidagdag ko lang yung
Yes,
sa suppression, no. Like what Dr. Tonyo was saying, pag sinuppress mo siya, after some time, marirelease mo naman ng kuminsan masyadong ano ba yun?
Excessive.
Excessive,
no?
because parang na-suppress mo, so parang nag-build up siya.
Yes.
Yes. So, ang isang itinuturo, lalo pa sa mga bata, or kahit na sa older people, substitution of action. Like, if you feel like doing that, then you do some action that may relax you. Kahit na yung kuminsan, kahit yung mag-stretching, or probably yung parang mag-flex mo yung iyong arm, no? And then ang mga kids, pagka madalas sa gaganon, what I tell them is, what do you like to do most? Like mag-drawing ka? Or kumanta ka? You'll be surprised. Yung people na may mga complex tics, ang gagaling kumanta. Pag kumakanta sila, hindi mo mapapansin na may Tourette sila.
Oh, talaga? So you can
Right.
channel that
Yes.
behavior into something
Yeah.
more productive? So
Yes,
to speak.
that's why one of the most important part ng management is what we call behavior modification. Oo. Parang tinuturuan mo yung tao kung paano niya matulungan yung sarili niya na ma-modify yung expression nitong mga tics na to.
Okay, so that is a way to prevent it, aside from medication.
Yes.
That
To
is-
control, not prevent.
Not prevent.
Yeah.
So you
Yes.
cannot
Cannot
prevent
prevent.
it.
Correct.
There is no
Control.
cure.
There's no cure,
Not
but
preventable, no cure, but
Yes.
can be controlled.
Can be controlled.
yes.
Yes.
Well, if you look at the natural course of tics and for tics, not necessarily Tourette's, no. Like what Dr. Aida was saying, no? So you have bimodal incidents where they peak, usually in the early childhood, mga 5 years old and the 12, but noticeably, about a few of them would actually disappear. Now, we have what we call the rule of 1/3. 1/3 of them would probably disappear by the age of 20 to 30 years old. No, the tics would improve. 1/3 will have residual. They'll have some manifestations, but are quite minimal, not as much as when they had it, when it was picking up. No? And then 1/3 will have worsening of symptoms. No?
So this is with or without help? Can tics...
Yes, that's without help.
That's without help. So talagang that's the natural course
of
a tic.
Yes.
So there's a period in your life that it won't be as, how would you say?
As bad?
As bad?
Yes, in manifesting.
Okay. Are males more affected than females when it comes to these tics?
Yes.
Or when it comes to Tourette in general?
Well, tics, no? So I would prefer to call it tics first before we say Tourette's, because by definition, Tourette's is a form of a tic. So it's actually more common among males than females. Actually, boys more than girls. It's more common in children. The reason behind this is they believe that tics are actually genetically based. So it must have come from genetic abnormalities. Unfortunately, we haven't found the gene. There are candidate genes that would say that it points to a tic disorder that is related to tics, but at present, hindi pa namin talaga na-identify. So, in genetics, there is what we call penetrance. When we say penetrance, this is when you have the gene, all right, if how often the disease would manifest. So not everybody with a genetic abnormality would manifest with the disease or the symptoms. In tics in general, boys or males have 100% penetrance. You have the gene, likely you'll have the manifestation. In females, it's roughly about 50 to 56%. So that's likely saying you have a 50-50 chance if you're a lady to develop a tic if you have the gene.
Okay.
Yes, but
So, developing the tic, whether or not you're male or female, will it happen during childhood? Can you develop it in adolescence, or can you develop it in adulthood? Is there a particular age or period of one's life that it comes out?
Mas common silang nagsisimula sa younger age groups. And then some would appear during adolescent and adult population. Pero based on observational studies, mas madami yung nagdi-disappear pag younger na nagkaroon ng tic.
Okay.
Kesa nagka-tic sila ng
older group. Yes.
When they're in their adolescent years.
Yes, and then during older period, yun yung mas kailangan ng investigation. Baka may ibang dahilan. May ibang underlying neurologic disorder.
Okay, but that is done when they're adults. As children, the behavior is just observed and diagnosed correctly,
Yes.
no? Yes, doctors. For a child, no, growing up with a certain tics, can he go to school? Can he perform certain activities that other normal children do or that his classmates do?
Yes naman. I have patients with tics who are actually in the honor roll, no? I mean, hindi naman
So,
siya
hindi
related.
nakaka-affect ng mental ability mo?
Except that if it becomes so severe and probably so, what do you call this, disabling, then naaapektuhan yung kanilang pagpunta sa school. And I think the most important thing is they are being bullied in school. Kasi tinutukso sila.
Yes.
Oo, na meron sila nitong mga behavior na ito, especially kung later part na, no? Oo, kasi pag pakonti-konti, paminsan-minsan, like sabi ko nga sa'yo kanina, nung bata ako, may
Yes,
tic
Doc.
ako eh.
Oh, you had it. Oo nga, you mentioned that. You mentioned that. Ano
And
yung
then
tic, if you don't mind me asking,
Head tic.
how would that manifest?
Umiiling-iling ako, tapos mga ganun-ganun ako.
Would you remember how old you were?
I was in elementary. Pero nung mag-high school ako, nawala na. And mukhang familiar, kasi may 2 other brothers, meron. Pero yung isang brother ko, malaki na, matanda na siya. Ang ganito naman yung tic niya.
He still has
Ganon.
it. Hindi
Oo.
niya na-outgrow.
Hindi niya na-outgrow. Oo.
Okay,
Hindi niya
was this
na-outgrow.
with or without medication na wala na lang yung tics?
Walang medication. Oo.
Okay.
Oo.
Doc Tonyo, I will look at you because
Yes.
when we cut while we were at a break, you also had a tic when
Yes.
you were in your...
when I was young, so I think I was
Teenage years?
about 7 years old,
Oh,
around
younger.
7 or 8, and then my mom was the one who actually napapagalitan ako because I had this repetitive eye movement when I would look to the right or to the left because there was an urge for me to do it and it was relieved by doing it. Of course, now I know it's a tic, but at that time, nobody knew it was a tic, no?
Yes.
So, yun, napapagalitan ako. It disappeared probably almost the same time as Dr. Aidas. When I hit high school, nawala na siya eh.
Okay,
It
so
went
nawala
away.
na siya. It just
Without
went away
medications,
completely.
Yes, completely.
Okay.
No consultations. I wasn't seen by any doctor at the time.
So,
Yeah.
well, it's also nice to know that, no?
Yes.
Nice to know that little bit
Naging
of
doktor naman
information.
kami.
Yun na nga. And
Actually,
you're,
madami kami in our society who are
oo
actually
nga, and you're a neurologist, and we're
And
talking
you're a
about things, you're a movement
Right. Specialist.
and you had that movement as a
Yes.
child. Are there complications? Meron bang underlying complications?
Complications.
Yes, that when one has a tic, does it lead to other disorders, probably such as
Yeah.
ADHD or OCD?
Siguro hindi natin sasabihin complication ng tic yun. It's actually a comorbidity. Parang baliktad. Tic is a comorbidity of these disorders.
Okay.
Okay. Ano ba
Okay.
yung disorders na mention nila that are commonly associated with tic? ADHD, yung OCD, obsessive disorder,
Yes.
no? Okay. Sometimes it may be associated with some depression.
Yes.
And some patients with some parang psychotic disorders, no?
Okay.
Okay, pero it's not the other way around. It's not that people with tic would be prone to be like
develop
this,
that.
to have this. Hindi.
Okay, it's
Oo.
people who
With the
with,
OCD,
with
With ADHD, with obsessive compulsive disorder, with some psychiatric disorders that are prone
To
to develop tics or that may have tics.
So if you have tics, it doesn't
Okay.
necessarily mean you're going to get ADHD
Yes.
or
But
OCD.
if you have
Nagiging
a,
neurologist nga eh.
so you never had those ADHD
no,
or
I never had those
OCD?
Ma'am kayo. Well, okay.
Okay, now we'll find out.
Yes, we will find out.
But kasi, you know, your OC, your OCD, like
Yes.
frequent washing of the hands or frequent applying of alcohol or frequently doing something that is out of the normal or out of the norm, no? Hindi naman yun magli-lead to Tourette.
No.
Or to a tic.
To a tic.
Before Tourette, a tic first.
Yeah, no, it won't. Though
Okay.
you have to also be able to differentiate a tic from a compulsion. Because a compulsion is something, a repetitive movement, na ang feeling naman nila, if they do it, something bad will happen. No? So this is common among, hand washing, all right, parking at the same place at the same time, at the same venue. So these are things. So, yun naman ang feeling na end of the world or something bad will happen. Ang tic, they don't have that abnormality. It's just that undescribed discomfort.
Okay, it's not a compulsion.
That's not a compulsion.
Stuttering, before we cut to a break, stuttering.
Yes.
Is that
It's
a
not-
tic?
No,
It's not a tic. It's not a tic. It's some
well, it's quite hard to.
behavior.
Yeah, it's more of a
part
behavioral
behavior
problem.
Behavioral
Okay.
problem. Stammering,
Yeah,
stuttering.
it's repeatedly. Eh.
Yes, but they are not.
Okay.
Oh, but sometimes chin tremor, like that.
Yes.
Na? Sometimes they are part of these motor tics. Some people would have tremors here.
Okay.
Right.
Yes, ma'am.
Okay.
All right. So the tremors can be linked to a tic, not
Yes.
necessarily because you're stressed or you're nervous. Pwede rin.
Well, because stress and anxiety exacerbates or worsens your tics. So I think that's something na nagkakamali din. No? They say that kapag very anxious ka, you develop this abnormality. It's the other way around. No? You have tics and then it just worsens out when you're stressed and you're anxious. So mas madaming manifestations.
So we should always stay calm.
Well, that's part
Try-
of the therapy.
no?
You do relaxation.
Staying
Yeah.
calm and trying to understand or to differentiate your compulsion from the body movements
Yeah.
that are
Right.
not
Right.
normally done on a regular basis. Doctors will talk more about Tourette syndrome when MedTalk returns.
The early symptoms of Tourette syndrome are normally noticed first during childhood. For Marlon Banuevo, he first experienced motor tics at the age of 8. These proved to be difficult as he was constantly teased at school because of the way his face twitched and how he exhibited other involuntary movements.
Ang unang tics ko are motor tics, mostly facial tics, upper extremities. Nagsimula yon ng mga probably between 6 to 8 years old. To be exact, grade 3 ako nun. Tapos ang sumunod nun, vocal tics after a year or two, mga grade 6 ako, mga vocal tics na sumabay. But I got diagnosed only when I reached my first year in high school. When I was still much younger, lalo na sa eskwelahan, may mga pagtatawanan ka ng kaklase mo, may mga instances din na yung teacher mismo mapapahiya ka. Sa kaso ko, nilakasan ko lang yung loob ko. And one of the things that I did was, I tried to focus on my strengths. I tried to focus on the talents that I have.
His parents took him to various specialists, but it was only through a visit to a neurologist that he found out that indeed he had Tourette syndrome. For Marlon, this was a liberating experience, for he could seek ways to manage the disorder.
In my case, I actually felt relieved. Kasi problema ko dati, pag tinatanong ako, hindi ko alam isasagot. Sinasabi ko, mannerism lang. Pag hindi ko masyadong nahirapan ako sa kausap ko, nilulusutan ko na lang. Pero nung nalaman kong may pangalan yung sakit, kahit pa paano nahimasmasan ako, medyo na-relieve ako eh.
Today, Aside from being an industrial design instructor at De La Salle College of St. Benilde, he also plays gigs in music bars and makes music at home in his home-based recording studio. He now uses his experience to help and inspire others through the Philippine Tourette Syndrome Association, the first organization of its kind in the country.
We're back here on MedTalk, still talking about Tourette syndrome. Doctors, we'd like to invite all our viewers that they can call and they can join our discussion by calling our hotline at 548-4678. Marlon, the entire interview on the VTR, I didn't see any twitch nor no tick.
Well, there was some, but not as visible. It was not as
face.
frequent. Yeah,
Oh,
the face
okay.
was-
All right. I didn't notice.
Initially.
I didn't notice it. Okay, so it was, he was diagnosed, well, he started having the tics at 8.
8.
Yeah.
Yes.
Went to various doctors. You have to go through that process, no? To go to various doctors before you, so to speak, for the lack of a better, to hit the right doctor. A neurologist, and the neurologist then diagnosed him with Tourette.
I think because tics and Tourette's in general is are handled by your neurologist, your pediatric and your adult neurologist in general. It doesn't have to be a movement disorder specialist.
Okay.
So in his case, I suppose it would be difficult to judge
Yes.
given the situation. You know, it could have been also that the manifestations weren't as severe.
Yes, yeah. Or baka these symptoms were dismissed as tense ka lang,
Yes.
Okay.
nai-stress ka lang, no? Parang ganon, no? Kasi a lot of, that's the reason why a lot of people would come in late into the disease. Because they would always have reasons for having things.
Yes.
Diba? Like parang headache.
Yeah.
They ordinary lang yan. Migraine lang yan, yung pala tumor na.
Yes.
Right?
Yes.
Diba, no? So, probably it's also one way of telling our people na when you see symptoms and they are recurring and they are actually parang sort of worsening,
Yes.
then they should be seeing the right doctors, no?
Matiisin kasi, no? We
Right,
will try
yes.
to suppress or try to hold the pain or try to ignore the pain and focus our energies on something else when there's
Particularly
something
with
wrong,
this
no?
disease because it's not even painful.
Yeah.
Yeah, so it's just, some would even dismiss it at, like what Marlon was saying, it was dismissed as a mannerism.
Mannerism.
You know, because it could sometimes be masked into an activity. So
Yes.
people would actually might dismiss this as something normal, when in fact it's not.
Okay, but he led a normal life.
Yes, he did.
He went to a regular school. Is that advised to go to a regular school, or should the parents seek a
Special
different
school,
type
you
of, yes, a special school?
Definitely, if they do not have other comorbidities, they should be encouraged to go into a normal school. But if the child has a learning disorder, going into a regular school will cause more problem because coping with a regular academic subjects may stress the child out. And so the child will be having more of these symptoms of tics, no?
Okay.
So, management of Tourette, especially during the initial stages in children, should be actually a team approach. So you look at the behavior and then you look at the patient's profile, especially yung kanyang cognitive profile. Normal ba yung kanyang mental function, no? Oo. Yung IQ level ba niya, tama ba dun sa grade level niya? Kasi kung hindi, mas lalo siyang may stress. So, ang ginagawa ko minsan, you either put the child in a regular SPED class or para siyang naka-pull out lang. May konting tutorial,
Yes.
parang gano'n, no? Oo.
And that helps the child also, no? Because if there's a learning disability, then he won't be at par or grow intellectually with his classmates.
With the
With the
classmates, yes.
classmates.
And that's where bullying comes in.
Yes.
Yes.
Bullying is an entirely different topic
Yes.
altogether,
Right,
no?
right.
But we should also watch out for as a teacher, kasi the child is out of the house na, no? As a teacher, we should also be very keen and very observant of a student that might have a tic,
That's correct.
that might be bullied.
Correct. Usually in my practice, when I see children, no, with their parents, it's automatic. If I can get in touch with the teacher, I will try to get in touch with the teacher, or I instruct the parents. No? You have to tell the teacher that this is the illness of the child, that it's benign, that it's not harmful.
Yes.
Because sometimes, like what you said, no, it's actually the teacher sometimes who recognize these illnesses. All right, and then that's why sometimes they are referred to doctors. So it's like what Dr. Aida said. It's usually a team approach. It's the specialist or the doctors. The child, of course, being the patient, should always be taken into account of what he feels and what he wants done, the parents, and usually the teacher. So these are usually your partners in taking care of children with Tourette's or tics.
And partners, no, just going back to Marlon, his family
Very
brought him
supportive.
very supportive,
Yes.
brought him to a
Yes.
neurologist. He was first year high school, diagnosed with
Diagnosed.
Tourette, led a normal life. Now he's a teacher
Yes.
and a musician. So his motor skills were not
Yes.
affected if plays music, if he's able to write and
Correct.
to express himself, to teach.
Yes.
No, so it doesn't necessarily mean that there's a learning disability
Yes.
or you are not, your motor skills are impaired
Yeah.
because of that.
It's not supposed to limit you into your activities and your options.
So
Yes.
your quality of life
Yeah.
is the same as
Well,
Hindi
it
ka lang
should
pwedeng
be.
pilot.
Okay.
Yes, you cannot be a
You cannot
pilot.
be a pilot.
cannot be a pilot.
Yes, I
Okay.
think there are certain,
There
there are certain posts that you cannot
Certain
take.
fields.
Okay, what other profession na hindi pwede
Kung
na?
doktor ka, hindi ka pwedeng surgeon.
Okay.
Yes, because if you're
okay.
holding the knife,
Yes,
and
yes,
then
yes.
you incise.
Kasi
you know.
nga, it's not cured, but it's controlled.
Yes.
Okay.
And sometimes nawawala. Pero pwedeng lumabas paminsan-minsan.
Okay. Basta you know you have it. Kunyari, there's a period in your life na wala siya. It can come out again. So you have to be careful, conscious,
Yes.
That's
even
right.
without medication.
Yes, that's why among
Yes.
adults who manifest with initial symptoms of tics, you always dig in. When you were a child, you might have had a tic. It's just that it got, suppressed or it mellowed down already. Tapos ngayon lang lumalabas. But if you
Okay.
don't have that history, then like what Dr. Aida would say, you try to explore furthermore.
How important is early diagnosis? Dr. Aida?
Very important because actually it enables a child to understand how he will be able to cope up with the disease, knowing that this may be a lifelong disease.
Okay.
Second, very important is for the child and for the parents also, because it may be just a manifestation of other conditions. I'll give you an example. I have a patient who was diagnosed to have tic because of that eye tic. Ganun lang. Meron pala siyang seizure, and that seizure was secondary to a brain tumor.
Oh
No?
my.
So, I mean, these are very important things, no? But of course, if you are not brought to the right physicians, then this can be missed, no? Other important consequence of having early diagnosis, early recognition, is because you're able now to partner with the family. Like what was done to Marlon.
Yes.
Partner with the family, partner with the community, including the teachers. And so the other members of the community may also be educated. Because some people thought na nakakahawa siya.
Yes,
Right?
exactly.
Diba? Oo, baka mahawa kami. Or may ano siya, meron siyang psychiatric disorder. Diba? Some would say that. No?
Yes.
Oo, so it's important that they are already parang sort of aware of what the condition is. Kahit naman batang maliit, pwede nating sabihan kung ano yung meron siya.
And in bringing that awareness, we're talking about it on the show, and I'm
Yes.
really happy that you are with us and educating us on Tourette syndrome. You will continue to educate us as we talk about treatments and medications. We're talking about Tourette syndrome here on MedTalk. We'll be back.
Did you know that comedian Dan Aykroyd was diagnosed with Tourette syndrome early in his life? The actor who starred in numerous movie hits such as The Blues Brothers and Ghostbusters suffered from physical tics which were later on effectively treated through therapy.
We're back here on MedTalk, still talking about Tourette syndrome. Doc Aida, Doc Tonyo, we have a Twitter question this time. My child only seems to have a tic at home. Is this normal?
I'd personally say no. You know, that's not very typical of a tic unless the stressor is coming from the house.
Oops.
Yeah,
Okay.
so that's kind of I would suggest that whoever sent that message to bring your child to a neurologist.
Okay.
Yeah.
Or if I may add, probably
Yes, Doc
it might
Aida.
be what we call seeking behavior.
Yeah, attention-seeking.
Attention-seeking behavior.
Sometimes when the child wants the attention of the parents or siblings or even the helper, no?
Yes.
You'll do all the movements you can, the behavior you can,
Right,
just to
right.
get their attention.
Yes.
And if it's
Right.
only at home, then
That's not typical
That's
kasi.
not typical.
Yeah. Tic should be anywhere.
Okay.
Except sleep.
oh, there you
Except
okay.
Yes,
Tic
exactly.
should be
Yes.
anywhere except when you sleep.
Yes.
So, is there a way to monitor someone who may manifest a tic during the day? Is there like a test or
A test?
something?
Ako,
To monitor, find out if this individual has a tic while he or she is asleep.
well, kung tulog, you should never have a tic. Eh. Like, generally tics, di ba, you have to have the urge. When you're asleep, you're in a very relaxed state. Then you don't have those symptoms, so you won't have any manifestations. All right, so I would think twice of saying that this is a tic if this patient has manifestations when they're asleep. I'd probably refer to Dr. Aida. Kasi baka this might be something
Kasi
else.
something
you know?
else na underlying
Or there may be secondary
condition.
ito. So may mga benign conditions that are related to movements during sleep.
Yes.
We
okay.
call that
Yeah.
movement disorders during sleep. Yung
Yeah, parasomnia.
like pumapaltok-paltok yung pa, nagkakaroon ng parang mga mini jerks,
jerks.
pero hindi sila nagigising.
Yeah.
So
Okay.
usually I would tell the parents, anyway, everybody has a cell phone.
Yeah.
I-video na lang. Para pag dumating sila sa
Yes.
doktor, makikita.
Yeah.
Okay.
Oo, no? Kasi hindi naman ma-observe ng doktor, no? So, i-video kung ano yung napapansin nila na
Good
parang
idea.
behavior na hindi normal, no? So, makakasave pa sila ng pang-video EEG, mahal yung video EEG.
Yes, mahal pa yun.
Correct.
So, and everyone, you're right, everyone has that video feature on their
so,
phone.
video lang nila yun. Oo. Pati yung mga at home lang, yung like this parent who was saying, may tics pag sa bahay lang, i-video po ninyo yun.
Yeah.
Kasi, kung makikita ng doktor kung tunay na tic o
Tunay na tic,
hindi.
alright.
Okay. Even without bringing the child, no?
Yes,
Just the parent
yes.
lang.
Initially, yes, pwede. Pag ayaw ng bata.
Medications and therapies. Let's start with medications. Earlier, you mentioned that you experienced the tic during childhood. Apologies to go back to that.
Yes.
And you as well, Doc Aida,
Yeah.
experienced it. And
Wala
you did
din.
not have medications for it. You
Yes.
didn't take anything for it.
Kasi yun ang general guidelines. As much as possible, you resort to medications only for disabling conditions.
Okay. What are these disabling conditions?
Yung nakaka-affect ng kanilang daily activities of daily living, no? Or kung sila ay yung sa kanilang profession, parang disabling yung mga vocal tics nila or mga motor tics.
Okay.
Si Dr. Tonyo na yon. Otherwise, ano na yon? Behavioral lang. Behavioral modification. And then you ask them to substitution of relaxing actions, no?
Okay.
And understanding what they have. And not only them, but the family. Nakaka-stress naman yung parents. Huwag mo gawin yan.
Correct.
Hindi ma-help eh.
Yeah.
No, parent, you
It's
can't
a
help
natural
it eh.
thing, yeah.
It's a natural, it's innate in a parent to be very overbearing sometimes or
Yes.
talagang to be
Or
very
natata-
particular
yeah.
na, oh, don't do that. Oh, you're doing it again. Or best
Because
that's
of
a
fear.
stress.
and it's a stress.
Yeah, so lalabas lalo
It
yung
stresses
fear.
you out
Yeah.
and the child out as well. Baka lalong lumabas pa yung tic because it's a trigger for the child.
But there are medications. No? You still have some mood stabilizers that could actually, we can give. We have
Okay.
some medications that modify the transmitters, the one that was being discussed by Dr. Aida, that can modulate these neurotransmitters for you to be able to suppress, but not really treat, but not suppress these motor tics. That's another option. And then, but ako personally, like what Dr. Aida would say, it's actually a combination of at least two regimens. No? You have your medications, and then you have what we call, for pediatrics, behavioral interventions.
Modification,
Yeah.
yes.
For us, we call them cognitive and behavioral intervention therapy, or CBIT. These are usually carried out by psychologists and psychiatrists trained in the specialty to help modify the behavior so that they're able to manage around the tics.
Okay, oo. And for the patient to understand also that every time there's a tic, there is this modified way to work around it,
control.
to control
Yes,
it.
to control.
Others kasi they become violent, no? When the tics are really severe.
Yes. So there's what we call, at least in movement disorders, there's what we call malignant tics or malignant Tourette's. So these are very uncontrollable, bad Tourette's. So they're shouting, they're spitting, they're hitting or they're banging their heads to the wall. They're literally falling off the chair. No? So these are very good candidates for medications, pharmacologic interventions, and then cognitive behavioral intervention therapy. So you have to partner with the psychiatrist, usually, to help these patients out. No? So, but it's not as common as you see it. Yes. No? So,
Okay. Is surgery common for those with Tourette?
Not with Tourette, but if the cause of tic is secondary to some structural problem in the brain that may need surgery, yes.
Okay.
Yes.
But if you're talking about deep brain stimulation,
Yes.
okay, probably Dr. Tony.
DBS, it's very useful for Parkinson's because you already know where to target the electrode. So just to give you a very brief background on what DBS is, we insert a probe into the brain, in a particular area of the brain, and then we stimulate that part of the brain so that you have the manifestations of, for example, Parkinson's, you move more freely and you move faster. Unfortunately, in tics, we still don't know the exact location in the brain. So you need to have an anatomic location where to put those probes. So if you read into literature, you'd see a lot. No? They say na it was successful in 11 patients, in 1 to 2 patients. But if you review all of these papers that they did surgery, they were having varying locations of the placement of the electrode. So you don't know now which one to put.
Yes.
Now where to put it and then how to set it. So at this stage, DBS or deep brain stimulation is in the experimental stage, I would say, for Tourette's, but it's not advised among patients. You'd also notice that in DBS, we attach the electrode and there's a wire that's under your skin that goes all the way at the back. And then
Okay.
it goes to a battery, like a
Yes.
pacemaker, right?
Yes.
So if you have very bad malignant tics and then you start whipping your neck up, you can actually break the leads. So those are certain things that you have to consider when you are actually considering deep brain stimulation.
Okay.
So for now, it's mainly experimental.
Okay. While you were talking, doctor, I remembered my question about surgery. So now that you've explained it, if you cannot locate the particular area in your brain, then surgery is not
The best option
the best
for tics.
option.
Not at the moment.
Not at the moment. Not yet.
Not yet.
Yes,
Not yet.
Unless, like what Dr. Aida said, that you have a secondary cause. Let's say it's because of a tumor, then surgery, of course, would be beneficial.
Maybe in the years to come, no, they
Hopefully.
will find.
Hopefully.
Hopefully, I'm sure. No? with all the breakthroughs in medicine, they will find that particular area of the brain, and they will be able to zero in on that, and
Yeah.
just like Parkinson's, be able to monitor
Yes.
that particular brain activity. Other relaxation techniques, doctor.
I
Dr.
think
Aida.
music is one of the best
Oh,
ways.
nice. It's very soothing to
Look
listen
at-
to
Yes.
Look
music.
at Marlon, no?
Yes.
Yeah.
Music. How about art? Drawing.
Yes. Anything that deals with the right side of the brain.
Okay. Okay. So are you, do you do any form of art? doctors or music? Or
Not at the moment.
you are concentrated on helping all those
Yes,
who...
we try our best.
So doctors, please, any final message, any final words for all those who are watching the show tonight? Let's start with you, Dr. Aida.
Well, I think what we should actually tell the families and parents of patients with Tics and Tourette's is that this is actually not very rare would they be malignant.
Yes.
But what the people need, what the patients need are actually support from them, because this is the best way to help them out.
Okay. Support. I just want to pick up on that
Yes.
before we go to you, Dr. Tonyo. Is there a group? Marlon has a group, the Philippine Tourette Syndrome Association.
I'm happy that Marlon has a group, no? But I think the group of movement disorder from the Philippine Neurological Association,
Okay.
there's a council
Yes.
and there's a society.
Yes.
They're doing some lay fora.
Okay. All right.
Yes.
Dr. Tonyo?
Yes, ma'am. For patients with tics and Tourette's, and then the parents of patients with tics and Tourette's, you have to remember that a successful treatment is really dependent on partnering with your physician and making sure that you're able to discuss all your concerns. No, sometimes it's not just the parent's concern. You have to learn to talk to the child. A 6 or 7-year-old would already know what he or she wants. Sometimes they will be the one to tell you that I don't need the medication. So it's just a matter of making sure that you talk to your, being able to talk to your healthcare provider about it, and talk to the teachers. That's, I think, one of the advocacy that I would like to leave, that for teachers, please make sure that if you recognize this, avoid bullying by educating your students that this is just a tic, it's not gonna harm you, it's not nakakahawa,
Yes.
and things like this.
Okay. So thank you for talking to us. Thank you for educating all of us tonight on Tourette syndrome.
Thank
you,
you.
Dr.
Thank
Aida.
you
Thank you,
also.
Dr. Tonyo. We'll see you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation on 9TV. This is Angel Jacob. Good night.